Meanwhile, in a related development, the Ghana Health Service has denied allegations of poor COVID-19 testing among passengers at the airports, saying such viral complaints are erroneous. This follows concerns raised by some individuals and the minority in Parliament about what they say are discrepancies in the outcome of COVID-19 testing. Here's Dr. Franklin Esiedubekwe, Director of Public Health at GHS, giving modalities for the testing.
Let me say that protocols or guidelines are not static. I mean, they are meant to be reviewed. And when you are managing a pandemic, it's kind of a trade-off. So your main focus is to seek the safety of the population. So somehow, not the best, but we have to side with the population against that individual. But I think that based on whatever is going on, I think that as a country, we need to look at it. We have moved on based on our guidelines over the period. For now, as we speak, we do not have that space that you contest the results at the airport. But it's not a static situation that we may not need to amend it. What we are saying is that we were looking at a very sensitive instrument, which is the antigen test. So because it's so extra sensitive, it's about 99.9, it's possible we have a few false positives. So let me say that even those who are making the comments, there are instances that people have somehow doubted the results, but with time, they've come to accept that that could be true. You see, for science, there's not like absolute. I mean, that's the science. Yeah. So, and there are individuals who have different idiosyncrasies and different genetic makeup. So you cannot be very, that's why we give ranges. So if you look at the spectrum of persons coming in from outside to the country. So there's a starting point, which is that do a test. And then the test is that you do an PCR test. And we are saying that be negative. There are instances that people have come to Ghana with a positive PCR test and the airlines have been fined. If you do that, we fine you $3,500. So the idea is that the airlines should be watchful to be sure that people who are entering your plane are antigen negative.
Right.
You see, when somebody is coming, let's assume somebody could be at the early stage of a positive status, but then to be negative. And he comes to Ghana, and then antigen is positive. That guy can, after 2-3 days, move from antigen positive to antigen negative. It's possible. I mean, let me be also clear. When you have people who have been vaccinated, and whereby they have high utilizing antibodies, they have a high probability of clearing their virus. So there's nothing like a no-no in science. And I think that we need to be realistic with the issues going on. We are not saying
that's interesting.
Listen, let me say, we are not saying that there could not be false positives. What we are saying is that we need to be realistic and then move on with it.